We need to make it publicly known what is happening to nurses. We get kicked and punched and cussed at, and we're expected to just keep a smile on our face.
Patients and their family members are so raw. They may be very angry, they may kind of lash out at you. Some days you just kind of feel like a punching bag.
Over the 10 years I've been a nurse, the environment has become more aggressive.
We've come so far that every one of our rooms here in our emergency department has a sign that states it's a crime. Assaulting or threatening behavior will not be tolerated. It's getting difficult sometimes to keep smiling.
Especially if a patient comes to you and they're yelling at you or they're upset because it took longer for me to give them pain medication than it should have. But you can't say to that patient, hey, I was just trying to save someone's life next door.
Our society does not value what it takes to take care of someone. I feel like they feel entitled that a nurse is here to serve you. And I think that's maybe where the problem starts. We're here to help you.
Every time you take care of a patient, you're trying to give something from yourself. You're trying to give respect and give kindness and your knowledge, and if it just is always taking, same as with anything in life, you run out of steam. And I think a lot of the nurses are running out of steam.
Emergency nurses, their average stay in an emergency nurse as a profession is about 2 years. After about 2 years, they tend to go to seek other things.
Sometimes the change comes out of necessity. And I think more and more nurses have to find a way to have their voice heard.
I am part of the Emergency Nurses Association, and we stay up to date with national policy that involves the healthcare field.
I've been very active with Day on the Hill. When we, as the emergency nurses, go to Washington, D.C., we tackle issues that are the most pressing at the time. We have that firsthand experience to tell them these are the stories that are affecting the emergency care nurses throughout the nation.
My focus has been on the challenges we face with workplace violence, both in terms of understanding the magnitude of the problem, but also determining what we can do about it. There is some legislation in DC around workplace violence and some mandates around what facilities need to do. And that's something that, yes, we're going to continue to advocate for legislation on that. And I think the more that we talk about it and the more that we gather data about it and really know the absolute magnitude of it, I think we will see that we accomplish greater things around eradicating workplace violence.